Good morning and welcome to SSHA Academic Advising's virtual open house week. We are excited for you all to be able to connect with some of our faculty and students from the Public Health Department. Before we get started, just some brief introductions. My name is Amandeep Singh. I am the Student Engagement Coordinator for SSHA Academic Advising, as well as the SSHA Academic Advisor. Before we get started with doing introductions from our panelists, I also want to introduce my colleague who's joining me today.
Hi everyone, I'm Lauren Brackett. I'm one of the academic advisors in SSHA, as well as the student success coordinator for the school. I support students in the major and minor of public health, cognitive sciences, philosophy, English, and Spanish.
Awesome, thank you, Lauren. A couple of quick Zoom guidelines. If you have questions throughout the panel that you would like to ask, I asked you to use the Zoom chat feature at the bottom of your screen. Just feel free to put your questions there and I will voice your questions aloud. If at any point you do drop off the Zoom meeting just because of Wi-Fi connections, feel free to join back into the meeting and I will let you in. With that being said, we'll go ahead and start with introductions. So I'm going to hand it off to Professor Bradman.
Hi, well, welcome to everyone. I'm Asa Bradman, and I'm currently a professor in public health at here at Merced, and I've been here now since July of 2020, although I feel like I've only really arrived just in the last couple months because now I'm in person and it really feels great to be here. I'm actually now chair of the department here in public health. Before coming to Merced, I've done work for years on environmental health in children, especially, and also working in rural and agricultural areas in California. I got my start actually working with the state health department on cancer clusters in, we started in the McFarland area near Bakersfield, and early March, there was some historical cancer clusters that the state health department was investigating at that time, and then also worked in Rosamond and areas in the eastern Kern County, somewhere out in the desert. And then through that, I got involved in the public health department at in the state and really got inspired to work on environmental health in children. So did my PhD in that, and then we got some grants to do some long-term studies on health in agricultural communities focusing on the Salinas Valley. So should I ping pong to someone?
Should I go next? Okay,
Sure.
I'll go. Hi, I'm Cedric Goldman. I'm an associate professor in public health. I've been here since 2014. I am an epidemiologist by training. I primarily focus on mental health problems, particularly suicidal behavior. So I teach some semesters I teach the undergrad epidemiology class, PH 100, and then I also teach classes in our graduate program for PhD students. Right now I'm also the director of our PhD program, so that involves working with a lot of the graduate students, or all the graduate students, I guess, in our program.
Hi everyone, my name is Kessia Garibay, and I am a third year in the Public Health PhD program. My advisor is Dr. Denise Payan, and my focus is in health policy, and actually graduated from UC Merced with my bachelor's in public health in 2018.
Awesome, thank you all for introducing yourself. Going a little bit off your introductions, can I have you all talk a little bit about why you chose to be here at UC Merced and exactly why you chose to pursue public health? And we can start off with Professor Bradman.
Sure. So I think this story might be of interest. I originally was doing a lot of work in environmental science, and I was working on issues around acid rain, which is something that kind of dates back to the 80s. It was kind of a big deal around sulfur emissions from power plants impacting vegetation by changing the acidity of rain and snow. And I was involved in research in the Rockies. We were looking at kind of trying to look at the signature impacts for big coal-fired power plants in the Arizona Four Corners region. And through that, I just was involved in a lot of field work, doing a lot of chemistry and measurements of metals and things like that. And I just read an article in the paper about lead in drinking water fountains. And I just happened to be in a lab where I could measure lead in water, and I had the skills to do it. So I started collecting samples of drinking water fountains around the campus at Berkeley. This was back when I was just barely out of, I didn't even have a master's degree yet. And so I was measuring lead, and somehow my name got to some people in the state health department who were doing a study on lead. And they asked me to help with them and actually collect water samples and do some measurements. And so that kind of was my intro to public health. And I just got really interested in working on issues that affect people a little more directly than the environmental science type work I was doing. And so that's how I got into public health. And I've always been interested in pesticides and agricultural issues. And that kind of brought me to the projects we have in Salinas. So I ended up getting a master's. I did my master's on lead in drinking water, and then my PhD on environmental health in children. And it was kind of a natural next step to do work in agriculture. And there's kind of a little backside story here. Some people in California, Lynn Goldman and Dick Jackson, you may have heard their names, especially Dick Jackson. He was the state medical officer for several years under Schwarzenegger. And they worked on a report that looked at pesticide exposures in children and basically said that our standards for food tolerances are too high. And that led to something called the Food Quality Protection Act, which required EPA to regulate pesticides differently and to protect children in particular. And then that led to the Food Quality Protection Act led to EPA, excuse me, and NIH, joining up together and funding this new program to establish Centers for Children Environmental Health Research. And so we applied for one of those grants and got it successfully. And that led to, now over almost 25 years of research in the Salinas Valley. So when I heard about this position at Merced, I thought, I wanted to work more directly with communities and in communities that I've historically worked with in the Salinas Valley, but extend that more statewide. And so, everything about Merced kind of appealed to me in terms of the students and the demographics served by the community. And like I said, I kind of started my career in environmental health in the Central Valley. So this was a way to continue that and hopefully contribute something positive.
You can go next. That's so interesting, Asa. I didn't know about much of that. Let's see. So I was an anthropology major in my undergrad school. And towards the end of my time as a college student, I was sort of interested in like medical anthropology. And then my allergies are also acting up. I took an epidemiology class, actually. It was sort of, there weren't very many epidemiology classes offered back then at the undergrad level. And I sort of liked it. It was not like a mind-blowing experience, but I got interested in it. And in particular, there was a guest lecturer via like an early version of Skype, I think at that time, who talked about social epidemiology and sort of the underlying root social causes of disparities in health problems and health outcomes. And I really liked that. I really liked that lecture, and that kind of stuck with me. I also worked after college. I got a job doing health policy kind of research and consulting. So I moved to Washington, D.C. for a couple of years, which was a fantastic experience. But by the end of the 2 years, I realized that even though I liked that job, I did not want to do health policy work, but I had gotten sometimes jobs are useful because they tell you what you don't want to do. But it was a good experience. But at that point, I knew I was interested in health. So I applied to Master's in Public Health programs and got into several of them, including the one at Berkeley, which was always my top choice because they had a good kind of social determinants of health program there. And so that was where I went and loved the MPH degree sort of experience that I had. And I think to the end of my MPH, I decided that I didn't know if I wanted to go into academia or not, but that I thought like the things that I wanted to do, like no one would necessarily believe me unless I had a PhD. Like I sort of wouldn't be able to progress and do the things that I wanted to do unless I had a higher degree than a master's. So I applied to only Berkeley's PhD program. I didn't really want to go anywhere else. Luckily I got in. So that was the epidemiology PhD program. And I guess soon after that, I didn't really know what sort of health outcomes I was particularly interested in. But actually at the time I was dating a guy who had suffered from chronic depression for much of his life. And it was, I honestly think I just got like interested in depression because of that guy. And I just got sort of more and more interested in mental health problems in general. And so ended up focusing on kind of life course determinants of mental health problems, and then just kept going with that. So I did a postdoc, which is just like a research position for 2 years after I got my PhD. And then I got the position here at UC Merced. And I think I was interested in UC Merced for a lot of different reasons. I'd done my graduate studies in the University of California system. I knew how great it was. I knew what the kind of opportunities were like. And I really liked the idea of coming to sort of a new young campus that was doing innovative things. I really liked all the people that I met here when I came and interviewed. The students, everyone raved about how fantastic the students were. And like that has definitely panned out. It's one of the best things about being here. And yeah, it was a good job offer. So I've really enjoyed my time at UC Merced.
Yeah, so for me, why public health? I actually came to UC Merced as a pre-med student, but psych, I was majoring in psych, but I changed my first semester in my undergrad to public health because I was taking global health and I really enjoyed the topic. I always knew that I wanted to do something where I could help people, and I just didn't know how yet until I got into public health. And I realized you don't have to be a doctor to help people out. I didn't know what area in public health I wanted to study as an undergrad. I was able to, I was fortunate enough to work with a lot of different professors on different projects, and that showed me what I didn't like, but also some of the things that I enjoyed. In my last semester, I took a health policy class with my advisor, and that's when I knew that health policy was for me. I wanted to be able to help the community, but not necessarily be on the grounds all the time, but also address the structural, or figure out a way to address some of the structural barriers that we often face. And so policy for me just kind of clicked. Why I decided to stay at UC Merced, because I didn't go anywhere. It always felt like a family here. When I came for Bobcat Day, before I accepted as an undergrad, it felt like a family. Everyone was so welcoming. Even now to this day, it doesn't feel like it's a competition here. Everyone has just been super nice. All the professors have looked out for me and always, whenever an opportunity came up, they've reached out to me about it. So I always felt like this was home, and that's why I never left, because I still have that sense of feeling. And I know that everyone has the best interest for me. And so they're always looking out for me, helping me in any way that they can. And I didn't want to leave that. And I wasn't sure that I could find that in another school, so that's why I decided to stay.
Awesome, thank you for sharing that. So next question, I know that Professor Goldman Meller kind of talked a little bit about some of the courses she teaches here. Professor Bradman, if you can also talk a little bit about some of the courses that you teach, and for both of you, what are some good academic behaviors to be successful in your courses? And then for Casey, if you can talk a little bit about maybe some of your favorite courses so far here at UC Merced.
Well, so far I've taught online the global health class and then the intro to environmental health. And then this fall I'm teaching a graduate course that's focusing on kind of toxicology and risk assessment. And we'll probably also be touching on chemicals policy, regulation policy, and things like that. So, you know, what I could say about how to do well, you know, I really encourage students to not be shy. Often when I teach, especially a bigger undergraduate class, there's always like about 10 or 15 students that are really engaged and really take advantage of my time and, and resources. And I just encourage as many students to do that as possible. You should always remember, your professor, when they're teaching a class, that's their job, is to be available to students and to provide help and resources. So be sure to take time to knock on doors, or at least go to office hours during by Zoom if necessary, but really take advantage of the availability of your professors. And I know for me, that's part of what makes teaching rewarding. And those students, universally do better than I think than people who hang back. There's always some people in the class who don't like the class, or they're there because it's required, and I understand that. But even still, you can make the best of the situation you're in, and again, really take advantage of people's time. I've had times where I was available for office hours and nobody showed up. That's, I would just recommend that you really block that out. And also, I make it clear that if you can't make my office hours at that time, I'm happy to set up a special appointment or another time. And when people say that, take advantage of it. It's good to put yourself out on a limb. And sometimes, well, not in context of a class, but also don't be shy about reaching out to other people, asking for resources, meetings to talk about the work they do, what job opportunities they may have. Feel free to talk beyond just the content of your class. And if you do send an email to someone, say, and you don't get a response, don't take it personally. I make it a point to answer pretty much every email I get. Although when I get contacted by reporters, I'm not as generous. But if someone doesn't get back to you, don't take it personally. I'm kind of amazed at how busy I am, and sometimes some things fall through the cracks. So, put yourself out there and don't take things personally, and make sure you kind of build those relationships. And just to end this kind of spiel, also, it's important also to, for example, if you're going to be asking for a letter of recommendation for a graduate program or something like that, it's important. Those relationships are important, not only just for your own information, but, if you want that kind of support going forward. And I'm happy to write letters for people. Again, that's part of my job, is to help undergraduates, succeed and get out there. So, don't be shy about asking for that either. And, be clear on what kind of help you need and want.
I totally echo everything that Dr. Bradman said. If you sort of think about it from the professor's perspective, like if I get asked to write a recommendation letter for a student who, maybe graduated 2 years ago and is now applying to grad school, which is great, but they never came to my office hours, never introduced themselves, never said hi to me. I teach the undergrad classes that I teach tend to have, about 100 students in them. And so literally the only possible thing that I can say in the this letter of recommendation is, X student took my class and did well in it. And like, here's the kind of things that they would have learned in that class. Because if I don't have like a personal connection to you at all, like, what can I say? Like, I don't know you. So it really is important that if there's any chance at all that you might be applying for jobs or graduate school, you know, that you might need like a recommendation for, and like you will need a professor's letter of recommendation to get into grad school, generally speaking, then it's, you know, build those relationships when you're taking the class with those people. You know, go to the office hours of every class that you take, because you don't really know which professor you're going to end up clicking with. You don't know what, you know, topic you might end up kind of specializing in, and what class you might end up, you know, really loving. So yeah, the other thing that I would say about advice is, you know, do the things that you're supposed to do as a student. I'm always kind of shocked at how many students, you know, don't do the readings. Like, you know, if you're going to take a class, like you're here paying a bunch of money to be in college, and, you know, do the things that you're supposed to do as a college student, which is, you know, doing the readings and engaging in the material, talking with your fellow students about it. Oh, let's see. Rachel asks, what are some things that students talk about or ask you that makes them stand out? That's a great question. So like when students come and talk to me, you know, a lot of students will come when they come to office hours, or, you know, have a meeting with me. Sometimes they want specific help with kind of specific, you know, problems. And I'm always happy to help with that. That's like the first priority. But usually either they or I will like also ask them questions about, you know, where they're from, blah, blah, blah. And so I think students tend to get more out of those conversations when they just ask me kind of general questions about like where did you get your MPH? Like, how did, you know, the kinds of questions that Amandeep is asking us, like, how did you get into public health? Like, what, you know, did you work after college? How do you think about that? And from there, it can really just turn into you know, a bigger conversation. I've had students, I think it was really especially tough, you know, during when we were all online. It's hard and nerve-wracking for students to come to Zoom office hours, at least at that time. But, you know, I had this one student who came to my office hours in the spring semester, and like something that I was doing during class was like playing music during the intro and during breaks and stuff. And so he came on and was like, I feel like I'm doing fine in the class, but I'm actually really interested in your music tastes. Like, what kind of music do you like? We had this really great conversation about music, and like, you know, that was a nice thing, I guess, about the Zoom learning, is that like I would never play music in ordinary circumstances, but it allowed for this you know, point of conversation. And then like it spiraled into this larger conversation, and like I ended up funneling like job applications to that student because I knew what he was interested in, and like, you know, what he was majoring in and what he had experience in. So you just like never know. You basically can start anywhere with those questions, and it will kind of build from there.
Yeah, I think my question was about my favorite class. So I guess I'm kind of biased because my favorite class was health policy, because it's the class that helped me determine what I wanted to look at study, but also because it was really challenging for me. Dr. Fayan, Denise has us write during our exams, and I had never had an exam where I had to write an essay before. So just throughout the whole class, she was always challenging us to work on different skills that we needed to build, so when we're able to be out in the real world, we can apply those skills. But yeah, that was my favorite class.
Awesome, thank you for sharing that. We talked a little bit about research, and I think you all mentioned some of your research interests. If I can have you all just elaborate a little bit on your current research, if you're doing any, and how can students get involved in research on campus within your department?
I can start, I guess, and then Asa, if you want to talk about your stuff. So yes, I do research. I guess like something that students often don't know is that, like, other than teaching, research is like the primary thing that we do for our jobs. So actually we spend often more time doing research than we do teaching. And that's actually like a big part of how we're kind of evaluated. So research is very important to our jobs. So I do research on mental health, like I said, on suicidal behavior. I I do research that uses, for the most part, large scale kind of hospital data. So I do research on people who have come to the emergency room for mental health problems, physical health problems, sometimes for suicidal behavior. And I kind of track what happens to them is a lot of what I do. So I look at like how likely they are to die or to come back to the emergency room for other reasons and who is most at risk. I look at things like, you know, does hospitalization, you know, being hospitalized in the aftermath of a suicide attempt, like affect your likelihood of dying by suicide later on. So I do all kind of quantitative research. So I will say that for the work that I do, it is a little tough for undergraduate students to get involved in it easily, because it's working with like big data. So you basically need a bunch of statistics skills to really engage in it. I have worked with a lot of research assistants, but I'm like, in order to be a research assistant in my lab, you have to have done well in the epidemiology class. And usually in the past, I have had them take a seminar course that I teach, in which I teach students how to work with hospital data, sort of medical record data, so that then like after that, they know about the basics and they can like keep doing work with me on a sort of a more high level after that. But I don't teach that class anymore. And so I'm actually like, maybe we'll offer a version of it in the future. I don't know. So I'm actually like not totally sure how I'm going to get research assistants kind of into my lab. Anyway, but other faculty work with like big teams of research, undergrad research assistants. And so that's a different model that can be really great for students. When I do hire students, what I typically look for is like solid skill sets in terms of their statistics and like statistical coding skills and their writing skills. Writing is an incredibly important part of research. And so like, I hate to say it, but like I assess the quality of their email to me. Like that is an indication of like how good of a writer are you. If you can craft like a well-written, like, you know, polite, sensible email, that's an indication that you're a good writer. So I look at that. And then I look to see if they have any stats coding skills and if they have an interest in the topic. So anyway, that's what I do.
So I guess, are we pinging to me to talk about research? Okay. Actually, I want to go back one thing about Dr. Goldman Miller's comment about reading, and I just want to emphasize how important that is. Sometimes I feel a little old-fashioned because, you know, when I was a student, almost all we did was read things outside class, and now I feel like there's often now we read things on screens if we're reading at all. And then also there's all this, you know, visual and video and stuff like that. And I sometimes try to find videos that kind of explain some of the concepts that we're dealing with. But I do think reading is active, and, you know, watching a video is passive. And so I think doing reading is just really important. And I think people do less of it now than they used to. And, you know, every person when they get older says, oh, the younger generation is falling apart and they're not, you know, so, you know, there might be kind of a generational thing that's going on that is just is not important. But I do think reading is important. So I'd be, you know, I just want to can't overstate my agreement with Dr. Cedric Miller on that, Goldman Miller on that. But back to the research I do, I've kind of been involved in a lot of different kinds of things, and they generally revolve around the theme of children and environmental health. You know, we got this grant to establish the center at Berkeley on children's and environmental research, and our core project was a long-term birth cohort study in the Salinas Valley, and we started back in 1999, and we're still following kids and families from that study. So that's been, you know, the kids now some of them are at Merced. You know, it's been a long project. And ancillary to that, I've done a lot of studies on pesticide exposure from food to farm workers. We've looked at interventions. And then I've since kind of branched out into some other new arenas. About 10 years ago, when my kids were in childcare, I got really interested in childcare, and I got several rounds of funding from the state to both do studies on environmental contaminants in childcare facilities. We looked at air quality and chemicals and phthalates and pesticides. And then another nice piece of it is Department of Pesticide Regulation gave us money to develop curriculum on strategies saved to reduce pesticide use. About half of the childcare facilities in California are actually using pesticides to control pests, and we're always concerned about chemicals exposing kids that are very young because they can have a bigger impact, because young kids are still developing. That kind of led to also more work on air quality. We published some work on indoor air quality with the child care study, and then I was been working with the state to look at diesel exposures in along the California, the East Bay area in San Francisco Bay Area, so along the I-880 and 880 freeway corridors. And that has then led to some new funding. I have right now over $2 million in funding right now. One is a project from the Air Resources Board, which we hope to get going soon, that will involve sampling homes and urine samples up and down the San Joaquin Valley. And then that's something I brought over from Berkeley. And then I'm also working on an intervention study at schools to see if we can assess how well school air filtration reduces exposure to kids. And also very exciting, we actually just got a grant a couple of weeks ago for $1.2 million from the state to start a center for air quality research at UC Merced. So that's my first UC Merced grant, and I'm really excited about that. And that grant actually, I included very explicitly some support for undergraduate students in that. So we have some support for graduate students and at least one and maybe two undergraduates to work mainly during the summer. And that was partly because I want to provide opportunities for undergraduates. I have another student I'm funding just out of my, they kind of give us a slush fund when you start working here. So he's working with me to finish up a study on contaminants in breast milk that may derive from plastic containers and other collection and storage materials for breast milk. That was funded originally by the Human Milk Banking Association, and we're trying to finish up our reports. And so, just in general, something I'm committed as the chair of the department is trying to develop more resources and opportunities for undergraduates in research. When we look at surveys of students, many do have opportunities to work at faculty, but we know there's some that would like to, but haven't been able to. So I'm trying to expand that. And luckily with this new grant, we have a few more resources for that.
One thing that I encourage students who are interested in research to think about is what their skill sets are. And it's not like we expect students to already be great at research, because when would you have developed those skills? But it's a good idea to sort of take stock of what you are good at. So if you're good at math, then that's a skill set that you can sort of tout to a prospective advisor. If you are a strong writer, if you've been told that you're a strong writer, that is a skill set. If you're good at finding stuff on the internet, that is a skill set. Literally, there are so many undergrads who don't know how to Google stuff very well, and that actually is a skill set that we use in research all the time. So if you are good at sort of finding stuff on the internet, that is a thing that you can tell professors that you are good at. I mean, basically the thing to keep in mind is that we're super busy, and we don't, just like you guys are, right? Everybody's super busy, but we don't have a ton of time to provide really in-depth training to undergrads. And so what we love to see is students who are excited about working with us because they're excited about the topic, and they have sort of a concrete skill that they can bring to the table that could potentially help advance that research project. It's not so useful to us for a student to show up and be like, I'm an empty vessel and like I bring not much to the table, but like I'm excited to learn. We'd rather have a student who's like, I can do like this and I will be willing, you know, I'm excited to learn like these other things also. Just something to keep in mind.
Also, you know, be open to volunteer opportunities as well. I know sometimes that can be hard if, you know, you really need some financial support, but if you have the time and resources, you know, doing some volunteer work can lead to opportunities. I know when I was an undergraduate, I volunteered in a lab and got class credit for it. And
Yes.
I actually often give, in fact, this semester I have class credit I'm giving some undergraduates who we didn't have money for, but they're getting some, you know, real experience that's important. And that way there's kind of an official acknowledgement of that work. In my experience, you know, the work that I did on in the lab on a volunteer basis led to, you know, a job right when I graduated. You know, I spent the summer in Colorado, and then they actually got funding from a number of utilities to like study snowpack chemistry. And you know, the professor I work with said, "Can you do this study?" And I basically ran all the field work. And so just a reminder that, you know, kind of way leads to way. So if you get out in the world, way will lead to way.
When I was, I think my sophomore year, I remember taking health promotion, and the professor said research is really important. I didn't know what research was. I'm a first generation student, so everything that I was learning it on my own. And I went up to her and I told her I want to get involved in research because she said it was very important. And I expressed like the different interests I was interested in public health, and right away she connected me with Dr. Marilena Gonzalez, and that's who I started doing research with first. And it was on oral health, a topic that I wasn't really interested in at the time, but I gained a lot of really important skills that I was able to carry them on to the next project that I got involved in. But from there, I think just as one door opens, many other doors will open. I've done research, I have gotten research experience outside of UC Merced as well. There's a program called Health Career Connections, who then connected me to KP Launch, which is through Kaiser. And I was able to do it. The research project was different than the ones here, but I was able to do some type of research project with those individuals at Kaiser. And that was super interesting to be involved in a different organization or institution versus like UC Merced. So definitely there are research opportunities outside of UC Merced. You just kind of have to look for them and keep an eye out. Read your emails, your happenings. I don't know if they still send out happenings anymore. I don't get them anymore, but before a lot of students wouldn't read them. And there were so many opportunities in the happenings or emails that we get, we just don't read them. So definitely keep in touch with your professors and read your emails.
Yes, read your emails.
Yeah, and I, like, for instance, I would always stress out trying to write an email to my professor because I didn't know if I was using the right language or the correct terms. But definitely don't be afraid to reach out to them. I know that it's hard to take that step forward, but get to know them first. And then from there, they can tell you, but ask them about their research first. And then you can learn, see if there's opportunities in their lab.
Awesome. Thank you for sharing that. One of the other questions that we get a lot, and Professor Goldman and Mellor kind of talked about it, there's master's and then there's PhD programs for students. What exactly is the difference or the benefit behind getting just your master's or getting a PhD? And what exactly can you pursue with that?
Should I start or?
Go ahead.
Okay. Well, having also come from Berkeley, where there's an MPH program, actually there are several programs. They have an MPH in environmental health, which I worked with, and there's an MPH in epi, biostat, and also maternal and child health. So there's, a few different programs within the overall school of public health. And the MPH is a professional degree. So which is really valuable. I mean, it's kind of like a, you know, a certificate in a way that you have certain skills and resources, and there's a lot of demand actually for NPH trained you know, people. On the environmental health side, there's a lot of opportunities in state and federal agencies. Also on, you know, a lot of our students also went into, you know, industry and business, industrial hygiene. So there's actually a lot of opportunities there. I also know a lot of students went into, you know, healthcare delivery and worked for hospitals or other, you know, insurance or other health agencies, and especially with respect to health education and also program management. You know, others have gone on to work in more policy, like in the nonprofit world, or directly with legislatures at the state level or at the federal level. And so there's a lot of different kinds of professional opportunities. The PhD, and you can get an MPH and then get a PhD too. If not, you know, one builds on the other. The PhD often is more, you know, research oriented. So it's, you know, you want to dig deep into something and learn the skills and methods of doing the research. And, you know, on the kind of environmental and epi side, there's often going to be a lot of experience working with data and how to analyze it statistically, how to summarize it and present it. And, you know, on my side, it's also important to have experience with understanding, especially, you know, something about chemistry and chemicals, environmental fate, and exposure assessment and risk assessment. So that's a little less on the epidemiologic side, but it really kind of incorporates a lot of methods from different fields. You know, I kind of think of myself actually as kind of a jack of all trades. You know, I'm not an epidemiologist, I'm not a statistician, I'm not a chemist. I am kind of exposure assessment person, but really I kind of bring all those things together. I'm not I don't consider myself really math savvy in a way. So like math, if somebody explains it to me, I get it. If I read it, it's hard for me. But, you know, I also took 4 years of statistics, and although I'm not a statistician, I feel like I can work well with a statistician. And I'm not a chemist, but I can work well with chemists. So, you know, you don't need to be an expert in everything, but it's important that you have enough training so you know where your limits are. And then when you interact professionally with other people, you can understand what their job is and what challenges they're facing in the laboratories. It's, boy, it always sounds easy. Yeah, you just take a measurement and get a number. But, you know, I've learned since that really any individual number is never, it's always a distribution. It's kind of like an electron on an atom. You know, you can predict where it is, but you never know exactly where it is. And that's the way laboratory measurements are. Yeah, they give you a number, but it's plus or minus some uncertainty factor. So, so the PhD gives you more in-depth training. It does open some professional opportunities, often perhaps more leadership oriented. You know, I know when I was at the state health department, you know, there was a bit of a glass ceiling if you had a master's degree versus a PhD. And so you could go a little bit higher in the organization with a PhD, but then also you have to think about, is that what you want too? You know, I know like in the, you know, I find the higher up you get in an organization, you spend more time doing administrative stuff and less time doing interesting stuff. And so you have to think about what your priorities are. And, you know, having a master's degree opens a tremendous number of doors as well. And so you kind of have to just fit that in with, you know, what your life course is and stuff like that. I know if I would do anything differently, the one thing I would do differently on a personal level is probably have had kids when I was a little younger. so they'd be in college and I'd have a little more freedom now. But one of them just went to college, and we'll see how the younger one goes.
I echo everything that Dr. Bradman said. It's a little ironic that getting a PhD degree it can lead to more leadership positions, because one thing that PhD programs tend not to include is a lot of leadership training. So that's like, it's a little weird, but it, for whatever reason, like, yeah, that is true. For in terms of sort of basic information, so MPH degrees are typically 2 years long, and most people who get an MPH don't go on to get a PhD. Use like Dr. Bradman said, like it's a sort of a terminal professional degree, like, you know, so most people who get them like go on to great careers after that. PhDs take an additional amount of time. So some, but not all, PhD programs require you to have a master's in order to even get into the PhD program. And once you get into the PhD program, it's typically about somewhere between 4 to 6 years of additional kind of study and research and writing, and then you get your PhD. Yeah, so I don't know. I didn't necessarily think that I was going to get a PhD, but you know, as I was finishing my master's, it seemed like kind of the next best option, and yeah, I don't regret that at all. But you know, not everybody wants to do research. It's sort of like a specialized thing. Not everybody wants to focus in on a topic so much. Like, you end up really specializing in something when you do a PhD, and you know, not everybody wants to do that. So it's something to, it's, you know, graduate school is very different from undergrad, where in undergrad you can take all these different classes. You know, you pick a major, but like you end up taking classes in a bunch of different things, and like, yeah, the further you get in graduate studies, like the more you end up specializing. So you want to be real sure that that's the thing that you want to specialize before going into it, because otherwise, like, you're sort of wasting your time and your money also. So yeah, it's good to sort of think carefully about what you really want to do. So Rachel asked, how did I have the dedication to get my master's degree? I will tell you, you know, 2 years goes by real fast. The dedication, I think, more comes with a PhD. Getting the master's degree is, you know, it goes by so fast. You're just like taking a bunch of classes, and I mean, my experience of doing the master's was like, it was so fun, man. I loved it. You meet all these exciting people and like learn about all these different things. PhDs tend to be like a little bit more of a slog, because you have to be very self-motivated, because after a while, like, you take classes in the first kind of couple of years, but after that you have to work, you know, rather independently. You have your advisor, but you have to be like, have a lot of sort of self-motivation to like keep going, because it gets kind of unstructured, because you don't have like classes that you're taking. You just have to kind of keep yourself like moving forward on these, you know, on these projects. And that's tough for a lot of students.
Just a few other comments too about PhD. Sorry. So the MPH program also, typically, since it's a professional degree, has fees associated with it that you can make it kind of expensive. And we're actually discussing that about developing an MPH program here at Merced, which I think we all want to do, but we're also thinking about how can we ensure it's affordable to people. And you know, in the UC system, if you're in an MPH, there's this additional charge because it's a professional program. And then, you know, the private schools have theirs as well. I'm not sure what the tuition is like there. So, you know, it's not like the cost of getting an MBA or something like that, but it is something to think about. And, you know, with the PhD program, often you can get some support internally through the program. You know, like at Merced, there's kind of a commitment to provide opportunities to be a TA. And then, you know, at Berkeley and at here, if you're working with a faculty that has grants that is, you know, has budgeted for support for a graduate student, you know, then when you have that support, you don't get a lot of income, but importantly though, you get tuition fee offsets, which when you value that, and that's not taxed, it's actually it's a pretty good deal. You get, you know, you're actually getting paid a lot of money because you're not having to pay fees. So, but, you know, that can be a challenge. at Berkeley, and to some extent here it makes that too, at Berkeley, students didn't get admitted unless there was a faculty member committed to supporting them. At least for a few years, and then there could be TA-ships. At Merced, there's been a commitment to provide TA-ships and then grants if they're available. And like luckily with this new AIR grant, we have 2 years of support for 2 students. So that's a nice chunk of money there for students. But so it kind of what I'm leaning to, it's gonna be, there's a financial issue, it can also be a little bit of a political issue, and to kind of find the right fit. At Berkeley, there's many fully qualified PhD students that never get admitted because there wasn't a faculty member with a grant to support them. So again, back to my point earlier about, don't take things personally. When things don't work out, move on and look for the next opportunity. And I think Dr. Goldman-Meller's comments about self-motivation are really spot on. And also PhD programs, it's partly a political process too, because you're not just dealing with one person, you have to put a committee together. You have to make sure the committee is the right one for you, that people will put in time. Usually your advisor is really important, but you want to make sure that your other committee members are also a resource and are available. So it's kind of a process. I had a committee together when I was, working on my committees, and then there was one professor who, like, I forget the exact reason, but he was like, he was actually upset because I was one of the first students to go through Berkeley that did in environmental health that didn't do anything related to pathogens. So I didn't do anything related to environmental health, like water quality with respect to bad bugs, or respiratory diseases, stuff like that. And historically, a lot of environmental health got started like with tuberculosis and other kinds of issues. And they were like, you can't just do chemicals. This is not environmental health. And so he refused to be on my committee. So those kinds of things happen. And so you kind of have to craft your way through, as well as getting your work done and not procrastinating and getting your writing done. I didn't actually have any funding through the university, since I had a job at the state health department, and we made a deal with the health department that I would get paid 4 days a week, but I only had to work at the health department 3 days a week. And so they kind of paid me an extra day. And then I had, the part-time essentially to work on my dissertation, but all the data I used was from the health department. So, they got benefits because I published papers on their data. And then, I got benefits because I had a fairly solid job. I had health benefits and everything I needed through the health department job. So I didn't really need the campus. Although some people on campus were a little unhappy with that because I wasn't really on campus very much. Like I said, it's a process.
Awesome. Well, thank you all for sharing. We're getting close to closing time. So just as a final remark, any final parting words of advice for our students? I know a lot of them are coming back from a virtual world and trying to get back to in-person learning. So any final words for our students as we close in?
I totally sympathize about the coming back from virtual learning. I'm sure that it is an incredibly anxiety sort of provoking. It's been a very difficult year. I think like the fact that I'm assuming that most of the people who might view this are public health majors. I think the one thing that could be said about the last year and a half is that it clearly shows how important public health is. And so like, we would love to have you in our field because we need more public health, workers and researchers. So we're excited that you're here. And I think all of us in the public health department, I know there's only 2 faculty on the call, but we'd all love to, talk with you and hear more about your interests and encourage you.
Yeah, I don't think I have much to add to what Dr. Goldman-Meller just said. And also to reiterate to those of you on the call now, or if people are watching the video later, feel free to reach out, and I'm happy to meet in person or by Zoom or talk on the phone. Or so, like I said at the beginning, don't be shy, and look forward to hearing from you.
Yeah, and also don't be afraid to reach out to the grad students here. We're taking classes like you all, it's a different way, but we're taking classes. We have done research for a while now, and we've had internships. So please feel free to reach out to us so we can support you in any way that we can.
Thank you for organizing, Amandeep.
Awesome.
Yeah.
Thank you all for joining us. I do have a quick question from a student. So the question is, will there by any chance be a senior thesis option added to the public health program? So has that been in discussion at all?
That's a really good question. We have not discussed that. There's only a few such programs in SSHA on this campus. But it is definitely something that we could discuss as a faculty. So that's great that you're interested in that as an option. One thing to consider, since it's not sort of a formal option right now, is approaching a faculty member about doing like an independent study kind of course with them, and potentially like asking them if they would oversee you, writing a big paper. It's not like you could get sort of an honors, like thing on your graduation certificate, but that professor could potentially, write you a recommendation letter and say that you like wrote this big, this big paper. It might be a little hard to find a faculty member who would be willing to do that because it would be work. But if you're already doing research with them, it's something to consider.
Awesome, and thank you. With that, we're just going to close up now. So I thank all of our panelists for joining us today. The session is recorded, so if any of our students missed portions of the panel, you can find it on our website at a later time. Thank you all again, and I hope you have a wonderful day.
Thank you.